So we've already talked about startup cares, we've already talked about evaluations. Next we're going to talk about writing and reporting frequencies. So our job as FTS is to get you the patient referral. How you treat the patient, how long you see the patient, what you do with the patient is completely up to you. The first thing you want to do after you've completed your initial evaluation is to determine how long you want to see these patients. If you wanted to see the patient 2 times a week for 8 weeks, that would be written as 2W8. If you wanted to see the patient for 3 times a week for 4 weeks, that'd be written as 3W4. If you wanted to see the patient 1 time a week for 3 weeks and 2 times a week for 3 weeks, that'd be written as 1W3, 2W3. So pretty simple, and what that frequency is completely up to you based on what the patient's needs are. Once you determine what frequency you're going to write, all you need to do is notify our office. And what we do with that frequency is we then enter it into our system and we report it to the home health agency. So one of the things that you want to be aware of whenever you are doing an initial evaluation is before you see the patient for any follow-up visits, you want to make sure that you confirm with our office that we have the necessary authorization. We work with a ton of private insurance companies, and receiving authorization for visits can sometimes take 1, 2, 3, even 5 or 6 days. So before you see the patient for the follow-up visit, please check with our office to make sure that that auth has been received, because what happens is we get the frequency, we send it to the agency, they then send it to the insurance company approves it or declines it, notifies the agency, they notify our office, we notify you. Sometimes that process can take a couple days, sometimes it can take even longer. So, in an example, if you see the patient on Monday and you set a 2W3 frequency, or a 2 times a week for 3 week frequency, and you try to see them again on Tuesday for the follow-up visit, we may not have authorization by that time, and that visit may be void. So before you go and see the patient for any follow-up visits, be sure to check with our office, and we can tell you pretty quickly if we have auth or not.